Ladies and gentlemen, welcome to the next session. I'm delighted to be here as your moderator of the session on, in case of discomfort, ask your chatbot, intelligent robots and apps enter the healthcare ecosystem. And I have to apologize a little bit. I caught a cold over the weekend, so my voice is not very strong. I hope you can understand me okay. I'm joined here with by a very distinguished panel that are experts on chatbots and artificial intelligence. Just to my left here is Daniel Sonntag, who is a research fellow at the German Research Center for Artificial Intelligence, the Deutsches Zentrum für Künstliche Intelligenz. He's also a member of the expert cycle of the Medical Health IT Forum. Then next to Daniel Sonntag is David Hawig, who is the developer of the chatbot Florence, and we are going to be talking about Florence a little bit later. Next to David is Oliver Heinze from the Department of the Medical Information Systems at the University Hospital in Heidelberg. And then on the far right, from your perspective, is Dr. Eberhard Scheuer, who is the CEO of eHealth Consulting GmbH, Switzerland, and is also the initiator of the Forum Digitale Gesundheit. I'd like to set the stage a little bit for the discussion by discussing the healthcare ecosystem as a whole. We have to move from data to insights, and ultimately we have to move to outcomes. And we talked a lot this morning and also in the preceding session on education around data, big data in medicine, and how these data could be used to improve healthcare, to potentially also improve efficiency, productivity, and quality in healthcare. And a lot of focus is on this right now. But in the end, all these insights also need to be converted into focused actions towards improving the patient outcomes. And this is where the bottleneck very often is occurring. So today, in our session, we would rather like to concentrate a little bit on the right-hand side of this important flow and really try to focus on where we stand with chatbots, where we stand with intelligence, artificial intelligence in healthcare. And this is, I think, where our panelists have a lot to say. Is it hype or is it reality? That's a good question, I guess. We are at the very beginning here, not even at the end of the beginning when it comes to chatbots and artificial intelligence in medicine. But there are some bold predictions, and what you can see here is Professor Jürgen Schmidhuber, one of the thought leaders of the field, who predicted not long ago that in the near future, AI-supported medicine will be much better than purely human-supported medicine. And he went so far as to say lawmakers will mandate artificial intelligence-supported medicine. Well, what's the reality right now? I take one example, and I think we are going to hear in more detail from other examples. An intelligent agent, a human-like agent named Amelia, that was invented by a company called IPsoft, which is already today marketed as a digital employee and is being deployed into insurances, into financial institutions as we speak. It's a fully automated human-to-human agent that is able to understand context, to learn in an instant, and then to apply also these learnings, sorry for the design here of the chart, and then eventually also to resolve issues. Also, Amelia has a basic level of emotional capabilities. So something that starts to become or starts to feel very human, but of course also is still early days. Now, one of the areas of application for Amelia is in healthcare. And here is just a simple example from a pilot project that IPsoft is doing with the Veterans Administration in the US, where Amelia is essentially being used to assist carers to help veterans fill in forms and care plans, develop a care plan. There are many more use cases. The deployment is already starting in Europe. IPsoft is investing very heavily into healthcare subject matter expertise and is starting pilots as we speak. But this is not the only example, and this is why I'm grateful that today we are here joined by people who are working in this space also. Okay, so with that, I'd like to start the discussion. Maybe David, so what is Florence? Can you tell us a little bit about Florence?
Okay, Florence is a medication reminder basically inside your chat, but it's a lot more. We started out as a symptom checker, which you can contact inside Skype or Facebook Messenger. Then we integrated the medication reminder, we integrated some basic health tracking, for example, mood tracking. And yeah, the idea behind it was that I was working on a research project for elderly care, and we developed this great website, and we discovered most senior people don't use websites or smartphone applications, but a lot of them already use WhatsApp and Facebook Messenger to chat with other people. And that's why I thought maybe a chatbot might be the perfect solution, because it's easy. You can just write to this bot and he immediately responds. And so we developed Florence in June 2016, and since then, yeah, it took off. A lot of people answering reminders on a daily basis, not especially because it's a chatbot and there's a intelligence behind it, but simply because it's easy. You just open your messenger, you're chatting with other people, then you get your medication reminder, you can answer snooze or I took it, and you see your stats. That's it. So,
David, we have a short video to illustrate this. So let me try whether we can get it started. Short video says probably more than a lot of text here. Let me see whether we can get it started. Can you bring up the presentation again? Okay. Okay, great, thanks. So, David, how far are you? Is this being deployed already?
It is deployed. You can chat with Florence inside Facebook Messenger or Kik or whatever you are using, or Skype right now. It's actually used worldwide. But on a development stage, we are just at the beginning, because there's so many things you can do with a chatbot. You can highly personalize it. For example, for the medication reminder, if someone enters the name of the medication, you get personalized special for this medication messages. If you answer, I took it, or I didn't take it, you get the response, what you should do, based on the medical leaflet. So there are so many options and things you can do with this, and it's still work in progress, but it's good.
Okay. We'll come to the prospects a little bit later. Daniel, I understand you also work on this topic extensively.
Yes.
So, chatbots, where are we heading?
Well, the general problem in the applications which we have at the moment is there are no automatic capabilities in it. So whenever you do have like a chatbot or whatever, anything else, it's just based on the data which is programmed by a programmer, or the data directly which is put by the patient into the system. So there is no aggregation of that data, no interpretation. So we're heading towards systems where computers automatically interpret data. For instance, many medical texts, publications about that. Together with the data you do generate with your armbands or anything at the like, and the data which is from similar cases. So just finding similar cases is a very, very important application here, and the more intelligence you can put into that, the better results you get, and the better results you can give as a recommendation for your own patient. So this is one of the most important things. There is a second thing which is quite astonishing, and this reflects what we've seen before in the Schmidhuber example. I didn't know that you would bring it up. So Schmidhuber, he invented something on images which was for the first time something which is superhuman. So in a set of 50,000 images which were put into a computer, indicated mitosis on it. And an evaluation after that has shown that a team of doctors, of 3 doctors, came to an accuracy of 95%. And the accuracy of the system was 96%. So it was a very good example of superhuman performance in medical imaging. And it's difficult to transfer this, but in general, this is a very, very interesting story that this can happen.
Well, the German Center for Artificial Intelligence is also working on a respective vision for this. You were so kind to also share a video with us. You want to show it?
Yeah. So we can show it now.
Okay, let's do that.
So that's a fundamental research project.
Clinical Data Intelligence.
Clinical Data Intelligence, that's a project sponsored by BMWI, the Ministry of Education
Commerce
and Energy, exactly. And it's together with Siemens. I think you have to start it.
I'll start it now.
Yeah. And it's about medical decision support, automatic medical decision support. And this has been presented first time at CeBIT this year. So what happens here? So that's supposed to be a mammography screening. And first you have to generate digital data out of the process of finding the specific patient. And this is done via a digital pen. And this digital pen automatically digitizes the handwritten text, but not only digitizes it, but only understands what is being written, and it adds it to the patient record instantly. So there is no transaction time for that. So it's done instantly. So we have a new immersive environment which is in 3D, in virtual reality, and you can ask questions about the patient record, together with what happens according to the findings you have done.
Hier ist die Akte von Gerda Meyer.
Wie alt ist die Patientin?
Frau Meyer ist 65 Jahre alt.
Was war die letzte Untersuchung?
Frau Meyer hatte zuletzt eine Mammographie.
Wann war die letzte Untersuchung?
So now we come to the most important aspect,
that's
the automatic decision support based on a deep neural network on machine learning, which takes into account the new information and generates something. And this can also be done in real time.
Schlage ich Antihormontherapie oder Chemotherapie vor.
So this result stems from the clinical trial in Erlangen from a big mammography trial which has been done. Then Siemens put it into a neural network and we connected it in a real-time architecture together with the ICI to have it in virtual reality and speech.
Cool, thank you very much. It's exciting. And we will discuss it a little bit more. Now, Oliver Heinze, you are with a very large university hospital here in Germany, Heidelberg. Where does all these technologies get deployed already, or how do you think about them? How do you work with them?
Well, the topic of artificial intelligence has a very long history. It started in the last century in the 50s, and since then we have many ups and downs. And I think at the moment, during the last years, we have another hype right now. If you look at the consumer side, we see many startups building smart technologies to support patients in their daily living, for instance, to make treatment decisions or something like that. And on the other hand, we have traditional firms building huge infrastructures to support biomedical research, and we have some proof of concepts already, also in Heidelberg and at other university hospitals, but we didn't get the big breakthrough for now yet, and perhaps this is because of some reasons. I think the first one is that we don't have validated, trustable data. And if we have structured data we can use for those research applications, then we need to share it and combine it perhaps with other hospitals and other data lakes. And it's a matter of interoperability here, I think. And another reason could be that the systems don't have a right usability at the moment. Physicians don't have them integrated in their clinical systems, so it's very uncomfortable for them to use, for instance, decision support system based on the outcomes a research environment can provide today. So we use such kind of technologies, but it's not in over the whole hospital in widespread use.
Well, you're also developing a company. You're starting a company, Fellow 7. You want to talk about that for a moment?
Yes, Fellow 7 develops a digital health hub for patients because it's more and more important to include, to really include the patient in the whole healthcare journey, in the processes, and patients need a single place where they can manage their data under their control. So it's very important that patients keep control over their data. And you can compare it to an operating system. We are the healthcare operating system for patients. We have a safe storage mechanisms, and we also have an API which can then share the data if the patient wants to other services like apps or with bots. That's the idea behind it. And on the other side, we are connected to the traditional world, to the traditional healthcare systems like hospital information systems or regional health information exchanges. And the patient can then have a holistic view on the data and can use those data with other services he needs in his current health condition.
Is this already deployed at the University Hospital in Heidelberg, or?
The first prototype is ready, and we are building the first proof of concept now in the cardiology department. And yeah, hopefully we will widespread over the University Hospital and other hospitals during the next years.
Okay, Eberhard Scheuer. So you're an expert. You have been in this space for a long, long time. You have observed this for many, many years. Is this all hype or is it real? And what do you think?
Well, we had a conference 2 weeks ago in Zurich where we had the CEO of URMD from London here, and they have 2 million users for their pre-primary care app, which is supposed to replace the telephone hotline of the NHS because it's probably too expensive, people are getting tired, and so a chatbot is always on top of his skills. So. And they showed very amazing stuff, and they are going live with that this year, or coming year. So this is already real. But let me add something to the chatbot concept, because we see a lot of apps last 5 to 6 years, but in the stores we see more and more apps, but less and less download rates. The download rates are stagnating, and we see more and more apps. So why is that? We're only using like 5 or 6 apps every day: Facebook, Messenger, WhatsApp. And so it's, of course, it's a tendency, instead of building your own app, to hook on to that existing technology, sure, which also saves you quite some development money and time. And you can implement the chatbot, the artificial intelligence, into an existing app, which is a really great stuff. And WeChat in China has done that like 5 years ago, and nowadays you have a complete hospital system. You can tap into hospital systems and WeChat, and also have everything we are talking about now.
Yeah. Well, I mean, this is amazing. We have like 3 different concepts here around the panel already. Sometimes complementing each other, but also, of course, sometimes overlapping. What you bring up here is, okay, now, are you going to be part of a larger platform? Are you going to be standalone? How do you think about that?
To me, yeah. Okay. The idea, we are using Microsoft technology to a large part. The intelligence is from Microsoft, and the idea behind it is basically, I think, from the large companies, that you have these chatbots or these on top, like Cortana or Google Assistant or Siri, but then you have certain special skills, it's called, for Amazon Alexa, for example. You have chatbots for specific tasks.
Mike.
It's back. Okay. Yeah. And for these tasks, there are like apps, different solutions, and you need to target specific these tasks and solve them. And for us, it's, for example, medication reminder. And I'm a little bit shocked that there still is only, I think, our medication reminder inside Facebook Messenger. When I started, I thought all the big companies will do something like this. Adherence is a huge topic, and they will develop something similar. And we discovered really fast that when you are developing a chatbot, it's more necessary than with anything else to go out there, test your bot, get the data, learn from that, develop your intelligence behind it, train it. And I'm actually a little bit shocked that there's still so few chatbots in this area, at least publicly available.
And do you have any explanation for this, or any idea why this is the case?
I'm not sure. It's a little bit because of the law. You are not allowed to use.
It's also a question of the business model. So how can you make money, finance the development, and maybe for big companies it's not so interesting to do that.
Well, David, I'm always wondering, you know, how do you show the benefit in the healthcare system? You know, what is the benefit, and then in the end, how do you demonstrate it?
Yeah, that's actually more difficult. We see it, and so far there are studies, for example, that show that basic text messaging helps adherence, to improve adherence. So a chatbot is basically basic text messaging with a lot of added value. You can get immediately feedback, you can provide stats, you can integrate some way of gamification, so it should be a lot better. And we see users using our chatbot for a couple of 100 times, answering the reminders. But how do we show that these users wouldn't take their medication If they wouldn't use Florence, that's more complicated.
I guess it comes back to the question, who's ultimately going to pay for all of this?
Yeah.
And what's the idea around the panel on how this should work? I mean, we have 3 people here who are active in the development of all of this. So there must be some ideas here.
Well, I guess some patients will pay in the second healthcare market for some applications they really benefit from. For instance, chronic people suffering chronic diseases. But I think the basic services and functions have to be free for patients, and something else have to pay. And then we have the insurers on the one hand, but it's very difficult, at least in Germany, to come into the first healthcare market with new technologies. And another option is to have a shared platform business model where you generate your revenue streams from other sources. And that could be that you, for instance, provide other benefits to, for instance, research purposes or something like that. But you always have, in my opinion, to involve the patient. He has to be the master of his data, so you can't use the data and sell them to some people, so that's difficult. So he has to benefit from the use of his data too, I guess.
Daniel, I was very intrigued by this video that actually showed that there would be recommendations for treatment, like in a tumor board.
Yes.
So when are we starting to cross a barrier here where we potentially have a regulatory issue where this actually becomes a recommendation that somehow also needs to be signed off by a doctor, or if the chatbot is a doctor himself or herself?
Yes.
How do we handle that?
Well, it depends on how you define the assistance the particular machine gives.
Yep.
As we see it and like to implement it, it's a set of options. The best options we can get from the data from the images, from the automatic understanding of the patient material, and then it's like a ranked list, as if you went on Google or something and tried to get documents or so. Yep. But on a particular subject, which are the medical images, together with the patient data. Then, of course, it depends on how exactly the data has been aggregated. Maybe just pinpointing a particular point in an image or so is already a quite good recommendation. Mm-hmm. Or saying, in this patient record, at a particular paragraph or so, it is indicated that the patient cannot be treated by a particular medication or so. So the question is, how exactly does the decision support look like? And I have given those 2 examples, but in the end, it's still a recommendation, it's not a decision, it's not even a pre-decision, it's just more information on a level of aggregation which you can decide for yourself.
Well, I guess this is a question for the entire panel here, but what are the doctors actually saying about these ideas and these pilots and inventions that are being created here? Any responses?
The doctors I talk to usually like it, and they'll get the idea. They often say their colleagues say that they are scared about something like this, but there's a lot of potential there, and you can provide the information, you can collect the information up front before you go to your doctor, and just give him certain recommendations, not a perfect symptom checker or something, not the solution, but you can help your doctor with it. And that's the idea behind it, I think. Right now, AI is kind of a tool. It's just like everything else. It helps you to do something better. It can deal with the data, with large amounts of data, and can help you. But it's not in the state to replace a doctor in any kind.
We'll come to that. We'll come to that.
If we think about the title of this discussion, discomfort is something no AI is possible can do empathy or something like this right now.
very often we only talk to those people or to those doctors who are already open to the technology. So they are supporting our projects, and we really don't reach those doctors who are really at the forefront, treating patients out in the countryside. And for them, they only use such things if they can make money out of it. Well, at least in Switzerland, or they gain time by using it. And very often they have even more time. They need to deal with those applications instead of saving time. So for them, it's just something they cannot use in everyday life. So of course, we often target the patient with our applications. So there we find a more open mind of adapting such technologies.
Well, I mean, if you think about chatbots as just one component of a larger spectrum of possibilities we have with artificial intelligence in medicine, you can envision, of course, that there are much more powerful use cases and applications also in the future. I would be really interested what the doctors have to say about this, because I'm a doctor myself, and my sentiment would be there might be a lot of doctors out there who think that ultimately they might be replaced and not just complemented and supported by this. Any perspectives from Heidelberg here?
My experience is that it's twofold. It's 50-50. Some doctors like the idea to have well-educated patients who can be talked to on an eye level, and who knew very much about their illness, for instance. And the others say the patient cannot decide, and we shall stick to the old model. And I think the new technologies will influence the role of both sides. The patients are more informed and engaged, and on the other side, the physicians, or AI technology for physicians, when we come to the other side, for instance, for research support or for decision support, they can free the physicians from the burden of the medical knowledge explosion, for instance. So they don't have to read all those new papers every day, and they can go more, or they move forward to be more information brokers and interpreters in terms of how to use the AI results.
But if I understand you correctly, this has not arrived in clinical practice yet, even at a leading university hospital like Heidelberg. This is only starting.
It is starting. We have some locations like the National Center for Tumor Diseases. They are making use of those technologies, but it's not all over the hospital.
Okay. So I guess we are at the very, very beginning when it comes to that discussion. Maybe more broadly, I mean, in terms of artificial intelligence, we have heard a lot about it. Looks like we still have issues on the data side, a lot of issues. We talked about them this morning. But where do you see the most compelling use cases for this general trend? I mean, I was in the States 2 weeks ago, and a few people told me I have to have an artificial intelligence component in my value proposition of my startup, otherwise I will not get a very good valuation for my startup. So it's of course a little bit of hype right now, but then the question becomes, okay, where's the concrete benefit? What are the use cases? Any perspectives from the panel?
So from a research perspective, it is quite clear that the decision support I have shown is the killer application.
Okay.
For clinical purposes, for saving time of the doctors, for having second opinions, and for having a lot of like detectives on laboratory data or on data on the internet. I'm not talking about maybe publications or text written by patients. I'm just talking about publications in the medical domain by experts. So we have like 27 million on PubMed, for instance. So who should ever read it according to a particular case? And the second thing which is coming up is, of course, the engagement of the patient to a particular extent. And I think the electronic patient record is the most important thing here. According to an electronic patient record, we can also do data mining on the patient record, itself, and then also what the patient adds to it, potentially. And that will be very, very important. So the automatic text recognition from that.
Oh, you're talking about data that the patient would report herself or himself from his home environment. He might just type it in or contribute it.
He types it into a tablet, and then it will be loaded up. It can be combined with a clinical perspective. The third perspective would be to have apps which are more intelligent for consulting doctors. So we have like Health Vault in the US, we have Babylon in the UK. We have several developments here which are quite similar. We have also seen it in the videos there. So I think that if you can make a good decision when or not to refer to a doctor, this thing will become very, very popular.
Well, do you... Please go on.
To come back to your question, I think AI is overhyped sometimes because a lot of people who don't work with AI believe it's some scary thing who is thinking like humans and does solve problems. But right now it's really basic. It's able to understand things, learn from it. Like image recognition or sentences, but it's just at the infancy. It's for example, if I heard the example that a child is able to understand what a cat is based of 3 times or something like this. 3 images of a cat, and the child knows what a cat is. To achieve the same result with AI, you need thousands of images and train specific what a cat is to this AI. So it's really limited, and we use it on the text-based side to understand what the human wants, to understand the intent and entities inside the sentence. We now start to generate sentences with the help of AI to make it more natural. But the processing behind it, it's still just written code to send out medication reminders, to do the actual symptom check, to link the databases. So it's really basic.
Oliver? I totally agree. And I think another field or other use cases from another field of AI is planning. And for instance, not only in the hospital, but in the whole patient journey, there is so much room for improvement to optimize processes. And that can be, for instance, a bot or something like that to act as a gatekeeper and to do triage or something like that to decide for this patient where to go first. Because in the university hospitals sometimes suffer the case that people, because they don't get an appointment at their physician, come to the emergency department just with I don't know, a flu or something like that, and this we can much better organize by bots or something like that. Another use case can also be to support patients in therapy compliance, as you mentioned, and to keep them motivated to take their drugs, to use apps or bots, or to do their exercise, for instance.
I think everywhere where we have scarce resources, it can be of help. If I imagine, as you said, that the emergency wards are cloaked by people with very, at least in Switzerland, with very small symptoms like running nose, and so a bot would have told them first they don't have to go to the emergency room because they don't have a brain tumor or something, so they really can wait for a day longer. So I think where we can free resources like emergencies, and also if we look beyond our industrialized world, then we see like Africa or emerging markets where the doctors are a very scarce resource. So if we can provide like the senior doctor's knowledge, which is in an AI application, to people who don't have a medical education, but can use that knowledge in order to make the right decisions, like nurses and so on, then this is a really good application and is helping everybody.
Excellent. Well, thanks for pointing out these use cases. One is, of course, also associated with managing chronic disease, which is consuming a lot of resource in healthcare. Are we at a point where we already have observed something like chatbot fatigue already with patients? So are patients, do they continue to be engaged, or how does this look like over time?
Actually, it's depending of the user. Some users, for example, female users who use the pill, are really, they use it on a regular basis. They're used to answering the reminder. Young male users don't stick to their medication regime often, and that's the same inside our chatbot sometimes. So yeah, it's depending on the users, but also we have some issues there that the users who are testing Florence and using it on a daily basis are often young and healthy. Whereas the users we target sometimes, they are older, and once they get used to it, they use it, but at the beginning they believe like AI is this huge thing, and they start entering their whole life into our chatbot, and our chatbot cannot deal with it, with this long, complex sentences. So there's something we have to get used to it. We try some tours to change the gap between the user's expectations currently and what the chatbot is actually able to do right now.
Thank you. Well, we started with a bold prediction by Professor Schmid-Huber, which I showed you, which was, okay, this is going to be even mandated by lawmakers. Still ways to go, but it's a bold prediction. We'll have to see how it plays out. I'd like to start our final round by asking you, what's your own bold prediction on either chatbots or, broader speaking, artificial intelligence in medicine? Please speculate, and please make your own prediction here. Nobody is going to quote you, of course, but I'd just hope to elicit some statements here which potentially also help the audience to understand where this topic we have today is heading. Want to start?
Yes. So for my first comment, you can quote me because it will appear in the Deutsche Ärzteblatt next month.
Okay, good.
So it is like you can replicate technology, but you cannot replicate data. So by this I mean you can try to get a new AI technology in sense of machine learning algorithm and so on, and download it from somewhere or license it from a vendor or so, and then you have it. In your lab or in your hospital, but it doesn't help too much because you have to train it with actual patient data, and you cannot replicate the data because you don't own it. The data from the other hospital, which has made a lot of progress or so, and even if you did, so it doesn't make too much sense because you have other patient histories, so it's not the same population. So the question is, how can you do a quite lean and intelligent way of data acquisition, automatically digitized and digitized data? And this is very, very difficult at the moment, and especially in Germany, because the regulations forbid the exchange of data, but it also forbids the aggregation of data so it could be directly utilized in research projects. So this hampers the widespread application of this. And there I see a clash and a problem to be solved.
Well, what's your prediction here? Would you say this will be overcome and we will eventually either catch up or...
So the second part of the comment is it will not be overcome. This is the problem in the near future. So I see that we have to stick to clinical trials in the near future, also in midterm, and clinical trials are always for a particular set of diseases, diagnosis, and are very biased in this sense. So this will hamper the application of artificial intelligence because you can only rely on predefined high qualitative data sets from clinical trials, and this makes maybe 1% or something which would be useful.
Okay. David.
Okay, I just said that AI is overhyped, but I also believe that the potential is huge, and if we don't use it, somebody else will use it. For example, we have a lot of companies from India who ask us about our chatbot, and they are working on it, and the regulation is not as strong as in Germany, so they will develop this solution and they will get the data. So I believe that in a few years to come, there will be a lot more of these chatbots if they are created in Germany or somewhere else, I don't know. But I hope that more people start to creating these solutions, because if we look at our data and see that people answering reminders for so many times and asking questions about their medication, sometimes we are not able to help them, sometimes we are. I think the potential is huge, and hopefully there will be a lot more solutions like Florence.
Well, I mean, what do you need here? What do you need? Do you need a better technology? Do you need better data? You need money to develop all of this?
I need time. I need data to train Florence.
Yeah.
Everyone can start using it, and then we generate more data. And based on this data, we learn and integrate new things. But also on the intelligence part, there's still a lot of work. You need to personalize the messages. I talk that chatbots are not able of empathy. They don't know what you're feeling, but this could actually be really useful for adherence, if you send out messages to the right time with the right context, and tell the user maybe you should do this because the user wants something like this at this moment. So there's so much potential, and hopefully we will solve it, or somebody else will do it.
Okay, thanks. Back to bold predictions. Oliver, please.
Well, I think that we will see in the near future first market-ready AI-driven products in widespread use. Right now we have many users who already use such kind of technology on the consumer side, but also on the professional side, and it's just a matter of time, in my opinion. And but to get the real breakthrough, I guess we need to solve the three issues I mentioned at the beginning: interoperability, integrated care, and data quality, the usability issue, and to generate the trust in the product, in the AI-driven products, and in the data sharing.
Eberhard?
So yesterday I read, the older you get, the less good you are in predicting the future that's far in the future. So I restrict myself to the next couple of years. But if we look back 5 years from today, what was possible 5 years ago, and extrapolate what can be possible in 5 years from now, I think we will see a big change. And for certain, the technology and the applications will develop much faster than the knowledge of doctors and the users will evolve. So I'm sure there will be a lot of applications coming along our way, especially also with the potential of blockchain technology, where you can access a lot of data, and the integration of artificial intelligence and blockchain technology. I think that's a bold promise for the future, and that's also an advertisement for the panel which is happening an hour from now, which I also be a member of. So please come back in an hour and learn more about blockchain.
Well, with that, thank you very much, panel. It was excellent to have this discussion with you today. I hope we could shed some light on where the chatbot area stands, what the potential of artificial intelligence really is. And with that, I'd like to close this discussion. Thank you very much.